Investigators now believe that Academy Award-winning actor Gene Hackman and his wife Betsy Arakawa died about a week apart from one another. The medical examiner confirming that 95-year-old Hackman died from heart disease with Alzheimer's as a contributing factor. Arakawa's autopsy, on the other hand, revealing that she died from hantavirus. It's a virus carried by rodents, and people can become infected when exposed to rat droppings. Joining me now is Professor of Infectious Diseases at Vanderbilt University Medical Center, Dr. William Schaffner. Doctor, as always, thanks for being with me.
Good to be with you, Markie.
You know, I think people hear this and read this headline in the past couple of days and thought to themselves, I mean, rat droppings, could that be just as easy as sweeping those up in your house or your garage? What kind of exposure do you have to have?
Well, let's talk about the desert Southwest, because that's where it's actually deer mice that have this virus in their bodies. And yes, they can pee and poop it out. It dries up. And then when you want to clean things up, you might create an aerosol and it goes into your lungs. This is restricted to the desert Southwest. And then what happens after a few days, you get a flu-like illness with fever, aches and pains, some abdominal pain. You may not think very much of it, Markie, except another 3 days go by and suddenly then you become very sick, because what this virus does is make the blood vessels in your lungs very porous, and a lot of liquid then leaks out, and that makes it very difficult for the lungs to do their work. You have difficulty breathing, and then in a matter of hours, you can get very, very sick, go into shock, and without medical care, you can die. Yeah. And I suspect that that's what happened to Mrs. Arakawa.
It just sounds awful. It sounds painful. And hantavirus is not a well-known virus, right? It's very rare in the United States. According to the CDC, there have been less than 1,000 cases reported from 1993 to 2022. How surprised were you to read that this was the cause for her?
Well, of course, I was very surprised. We in infectious diseases and public health are familiar with hantavirus, but you never know when it will occur. These deer mice can get into the house and create a mess in the house. And then if you want to clean that up, you can create, as I said, that aerosol that you then breathe in. And something like that must have happened to Ms. Arakawa.
And it can be hard to diagnose, right? Why is that the case?
Well, it's hard to diagnose because you have to recognize the clinical picture. And the doctors in the desert Southwest, they're attuned to this. And had she had some medical care, which apparently she had not, I think the doctors might have put that on their differential diagnosis.
How quickly would this turn deadly for someone? Is it just a matter of a few days if you're not treated? And is there, you know, a cure or a treatment for it out there?
Yeah, the first part of the illness just looks like a mild flu. But when you start having respiratory distress, when you have this pulmonary syndrome in your lungs, then it can go very, very quickly. With medical care, we can help many people survive this illness. We do not have antiviral drugs that specifically get the hantavirus, but our supportive care can help many people survive this viral illness.
Yeah. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.